To date, nearly 9,700 Latino children have contracted coronavirus. That's nearly a quarter of them who are here in LA. CalMatters reporter Elizabeth Aguilera has been reporting on the racial disparities among our region's youth when it comes to COVID. And Elizabeth joins me now. Thanks so much for being with us.
Hi, Alex.
So, we have talked before, in fact, we've talked with fellow CalMatters journalists about some of the conditions that have led to such a prevalent rate of COVID among Latino populations, especially here in Southern California. But refresh our memory, what are some of the circumstances that are leading to these numbers?
Right. So, the medical experts and folks that I talked with about Latino kids contracting coronavirus at such high rates, point to the fact that they live with essential workers. Something we've been talking about when we think about the adult rate of coronavirus, right? Many people are getting the virus. They are essential workers. They cannot work at home. They are going out to retail, to restaurants, service jobs, grocery factories, agriculture. And so they are the ones that are getting exposed and bringing it home to the children. The other aspect of that is that many Latinos live in multi-generational housing or just live in crowded housing. They may live with a second family or, friends and other relatives to make rent because it's so expensive to live here. And so that also makes it hard for people who may have been exposed or even may have been infected to isolate from kids or from family members. So they may try to do that, but it's really difficult once somebody comes home with the virus.
Yeah, especially if you're talking about an entire family, maybe three or four kids, all sharing a one-bedroom apartment with one bathroom. Elizabeth, you spoke with several families. Maybe could you share a personal story that stood out to you of a Latino child who wound up getting sick?
So I spoke with one family here in Los Angeles who talked about, trying really hard to not, to keep the kids safe. They're following all the rules. They're using masks. They're not going out. They've isolated themselves. But the father in the family continues to go to work and he works in a restaurant and he was exposed first. And, the mother said, we tried really hard. But he really is the only person going out. And that's how he brought it back. Their 8-month-old child was the one who came down with the symptoms after dad. And now the three other children have been tested. She was waiting for results the last time I talked to her. And mother also got sick and was positive. So, um, I think that that's an example. They live in a one-bedroom apartment. So when the dad got sick, he slept on the couch. Mom took the four kids into the bedroom. But it's really hard to stay away from one another in a situation like that.
And of course, I just want to reiterate it's not as if there is anything genetically predisposing Latino kids more so than any other to get sick. It's a lot of these circumstances that you spoke about. We've been very fortunate, as you mentioned in your piece, so far here in California. There have not been any child deaths, although there have been across the country. And there are some concerns because some kids do wind up very sick. Can you remind us what is known about some of the complications that can develop with kids who wind up positive with coronavirus?
Right. So the doctors that I spoke with said exactly what you said. Thankfully, no kids here have died. And most kids show mild symptoms, almost no symptoms. Like that 8-month-old that I just talked about, he had a dry cough. He did not develop a fever. His mom was very happy about that. He didn't get extremely sick. But physicians are concerned because what they're seeing is kids coming to the hospital 3 to 4 weeks after having had the virus. And they're exhibiting this multi-inflammatory syndrome. And so it's a rash, it's fever, they're having a lot of pain, abdominal pain. And if they don't catch it right away, it could become a very serious disease, inflammation throughout the body, which could eventually impact major organs and their heart. And so physicians have been on watch for this and have created, this syndrome. It's a new syndrome. They just named it, saying this is connected to coronavirus. Of course, doctors say the more cases of coronavirus, the more possibility a child could get this syndrome. And then, that's a much more serious position to be in.
And as you mentioned in your piece, there have been quite a number of deaths among people who are of the parenting age. So even if the kids wind up surviving, sometimes, they wind up losing a parent or both, which is, of course, such an awful nightmare for any mother or father. Elizabeth, I want to talk about another piece that you wrote for CalMatters recently that was really interesting about what is happening in some agricultural communities and some teenagers there. Explain what's been going on.
So when school, moved online in March for most students across California, one of the things that I was thinking about is, of course, we're hearing about how students are impacted going online, getting access. Because we're such a large agricultural state, one of the things that I wanted to check in on and did was how are teenagers who would typically go out and work in the fields, maybe in the summer or during breaks with their families, faring. And I found many had gone directly from being in school to going back to work in the fields for various reasons. The kids that I spoke with said they wanted to help their families pay rent. They wanted to help their families make ends meet because some had lost jobs if they worked in construction or other fields. Some got their hours cut. Maybe their parents were sick, as we just talked about, having gotten the virus. So someone needed to fill in to help the family make ends meet and pay rent. So many of them went to work in the fields, which means that they missed the virtual learning that was going on, at least whatever live virtual learning might have been happening during the day. Your class is meeting, or you could have a meeting with your teacher, but they were out working. So the students I spoke with tried to make that up in the evening, but found that it was very difficult when they couldn't engage with someone live, and they tried their best to connect if they could.
And there's all sorts of concerns about that, not only the education that they're losing out on, but as you mentioned, there are some real potential dangers for young people working in these conditions. Can you remind us some of the reasons why we tend not to like to have young people working in this particular industry?
There's been a movement prior to the pandemic to try to get kids out of the fields. Under federal law, kids as young as 12 can work in agriculture when they're not in school or, on school breaks or off hours. But there are concerns about the fact that they're exposed to pesticides. They are interacting with big machinery that could maim and has, injured and killed some children in the past. So there's that effort going on to get kids out of the fields and into other jobs or keep them in school. And then the pandemic comes along and kids missed out also on their education.
Elizabeth Aguilera of CalMatters, thank you so much for chatting with us.
Thank you, Alex.
And viewers, don't forget, you can read Elizabeth Aguilera's work anytime at calmatters.org. And join us here on Inside the Issues each Wednesday when we check in with various CalMatters reporters to see what is happening here in the Golden State.